as the leg goes down. Feet go up, feet go down. Okay, so all control. Patients have some control on the bed here. They can raise their head up and down. They can raise their feet. Okay. Not the whole bed. So bed should be left for the most part, the lowest possible thing. It's a safety feature. The upper rail should be up. Labor and delivery beds, we usually don't have lower rails. Okay. On the mother baby beds over here, you do have lower rails. They can be up, they can be down. For the most part, I don't see any reason to raise the lower rails most of the time on the mother baby floor. Okay. But the upper rail, side rail should be up, and the bed should be in the lowest position. Okay. When you are doing anything more than a moment, in other words, you come here to take blood pressure, you leave the bed in the lowest position. Okay. If you're doing anything like placing in a folding, getting them prepped in position for the epidural, you're going to raise it to a comfortable height either for yourself or for the anesthesiologist to do the epidural. Most of the time in our unit, when they put in an epidural, the patient is sitting with her legs over the side here, and she curls up forward. When the patient is positioned for the epidural, what they have to do is take the natural curvature of their back and turn it the other way. So what we have them do is sit up with their feet over the edge of the bed, holding a pillow. Do not have them leaning their arms on their thighs, which they'll be sitting so close to. They shouldn't be leaning, that puts their shoulders up. They move their shoulders down and they move their back to come out. The easiest way to tell most people to get their back out there, I've heard it described as a sea, an angry cat, a giant shrimp. The easiest way I find to tell patients, they should sit up straight, put their chin on their chest, and then forget everything their mother ever told them about good posture and slump. That's exactly what you want them to do. Slump. The lower back comes out. That's the part where they're going to have their epidural. Okay? Now, maybe we better close the door. Patient first comes in. Patient comes in, they usually put on an external monitor. There's no way to connect it between the two. We are placed on two external monitors. The first monitor is the one that's going to be on the baby. It's a ultrasound monitor, basically, that works the way ultrasound does, that works the way radar does. If you're on a ship in a submarine, it bounces sound waves off. The easiest thing to do, the easiest place to place it, is against the baby's back. So, what you have to do is find out where the baby's back is. Okay? To do that, you do what's called Leopold maneuvers. Okay? There's 4 maneuvers. The first maneuver is to find out, first of all, is the baby head up or head down? Hopefully he's head down. Okay? So you're going to feel at the top of the uterus, the fundus. Okay? If you can put your hand on the top of the fundus and make a sort of V this way, on the top of the fundus, you've probably got a butt up there. That's probably the butt you're holding, okay? With the legs folded in and the butt in here. And then you feel at the lower portion, right above the suprapubic bone, okay? You feel there and see if you feel a nice hard round head. If you don't feel hard round head, but you are getting a butt up here, means the head is probably within the pelvis, okay? If you are feeling a hard round head, doesn't mean that this patient has to have a C-section, but you want this baby to eventually move down in. So first you're going to feel, essentially face the patient, face the head, and feel for a butt or head. If you feel something hard and round here and you can't pinch it, okay, then suspect that you've got a head up here. If you have a head up here, then your baby monitor is going to be placed higher, okay? So, first maneuver, you find whether you have a head or a butt. Then you find how deep it is into the pelvis. You're feeling the head here, or hopefully more likely if you're feeling a softer, slight indentation, which means the head is in, and what you're feeling here are the shoulders. Okay? So that determines your head is down, your butt is up. Okay? Then to find where the back is, you're going to put your hand down the side and feel. The back is going to be smooth. The other side, which would be the front, is going to have hands and feet, so it's going to have indentations. Okay? So, the back is laying this way, you have indentations here, and you will most likely, and the head is down, you're most likely going to find the back, and the easiest time to find the baby's heartbeat in the lower right quadrant. Okay? If you find the back is smooth here, and your indentations are here, you're most likely going to find it here. Okay? If you're finding it up here, the first thing you suspect is a breech baby. Okay? When you find the baby's heartbeat, and you put that belt around them. And then you're going to take the belt that monitors the contractions. Where are the contractions most powerful? At the top of the uterus or the bottom?
The top.
Top. Okay? So, you want to place this where you will find the most powerful contractions. You place it on the top, and then put it on, and both belts should be snug enough to fix without a gap between them, but not so tight that they're constricting anything. So, 1, 2, 3, 4. Leopold maneuvers. Sometimes you find a baby who's literally looking straight at mom's back, and you find the smoothness up here. Then you might find the heartbeat over this way. And sometimes you have the very contrary little people who have their back up against mom's back. And that you have to play around until you find what the easiest part is for. Same thing up here. Okay. Now, anytime you enter a patient's room, what's the first thing you do?
Identify yourself.
Hand
hygiene.
Identify yourself. What else?
Hand hygiene. Hand hygiene.
Hand hygiene. Okay, good. And you identify the patient. And she is wearing her bracelet over there. Okay? Please remember I am a deaf person. Do speak up. Okay. So you've identified all these. You've got the monitors on. Okay? This patient has labored through her labor. Okay? Now, the baby is, she's 10 centimeters. The head is crowning. We're going to deliver the baby. So what we're doing over here mostly, looks like the pelvis fell out.
Your pelvis fell out.
Okay. So what we want you to do is to break down the bed and prepare this patient for delivery. So, what you do is you remove the sheets. Pardon me. Put them down.
Oh, let's go.
This particular bed, we're going to pull this part off. On labor and delivery and Holy Cross, this has one set of sheets, the bottom half has a different set of sheets, so you don't have to take it off yet. Take them off, fold these in. These things are worked by the handle. You squeeze the handle, you turn it up and down, you turn it in and around. Okay, on the mannequins you can't go very far because the legs don't go very far. Labor and delivery, you adjust it accordingly. Okay? These are very rarely used, they form stirrups. I'll show you those in a minute. You get both legs out, both feet up, the patient goes out, and then underneath here is where the bed is. Okay? And what you're going to do, and just somebody hold these legs here. You reach in and you take hold of the hand, just hold the side there. Straight up and back out.
And there's the baby.
And there's the baby. And that's how delivery works.
Well, when we come to our scenarios, we push the baby that's in her tummy out, then we hand you the baby that's down there. Because the one that's in her tummy is extremely scrawny. Okay? When you go to put the bed back together, these two pieces go into the slots right there on the edge of the baby. Okay? And all you have have to do, no, leave that up there. All you have to do is walk straight into the bed and make sure you're in the slots. And then the last thing you do before you put the patient's legs, make sure you're actually in the slots. Then, when you do this with the patient, you want to use both legs off at one time. So, pull these down, put the legs down, then you put these down. Okay? Let's go down the back. Any questions on doing that? And then what I need is 6 of you to line up this way.
What's this?
That's what they can use to pull with on the cushion.